Hi, we are the Occupational Therapy Assistant Program, class of 2010, here at Lone Star College-Kingwood. We are demonstrating the use of a standard wheelchair.
Identifying and understanding the parts of a standard wheelchair. Although wheelchairs and adjustments will vary, the following are common parts: backrest, seat, and armrest. To remove the armrest, push peg buttons in while lifting up. This will allow the armrest to be released. To put armrest on, place armrest in 2 holes and push down until you hear the peg button click. Some of the other components of the wheelchair include rear wheel, hand rim, brake, and caster wheel. To apply brake, push forward. To release brake, pull back. Additional components of the wheelchair include foot plate, leg rest. To remove the leg rest, slide lever and swing outward. Then lift from pegs. To place the leg rest on, place holes onto pegs and swing inward until lever clicks. Further components are crossbar, frame, and tipping lever. To tip the wheelchair, place foot on the tipping lever and push down while holding onto the handles firmly. Assisted wheelchairs up the steps. If the patient requires a seat belt, make sure it is fastened securely before attempting to ascend the stairs. Arms should be resting on the lap, away from the wheels. Feet should be resting securely on the footrest. One person moves behind the wheelchair, places one foot on the tilt bar, and pushes down while pulling back on the handles, tilting the wheelchair backward. That person backs the wheelchair up to the steps, while a second person grasps the wheelchair frame. Standing with one foot forward and knees bent, they slowly lift up the wheelchair up the steps. Then one person holds the wheelchair while the other person moves to the next step. Working together, they continue to lift the wheelchair up the steps. Assisted wheelchair down the steps. One person moves behind the wheelchair, places one foot on the tilt bar, and pushes down while pulling back on the handles, tilting the wheelchair backward. The other person grabs the wheelchair frame and slowly brings it forward until the back wheels are at the edge of the step. Working together and bending at the knees, they slowly lower the wheelchair. One person holds the wheelchair while the other person moves to the next step. For assisted wheelchair up the ramp, have client rest hands on their lap. This prevents any accidental bumping of the client's arms and make sure client's feet are secure in the footrest. Push the wheelchair up the ramp while holding on to the handles. When going down the ramp, the back of the chair remains on the downside of the ramp. Slowly back the wheelchair down the ramp. There is an alternate method to assist a client down a ramp. Tilt the wheelchair backwards 30 degrees and ease wheelchair down the ramp in a forward position. The caregiver should keep knees slightly bent and back straight. To self-propel wheelchair up the ramp, face forward. The client may have to lean slightly forward to propel the wheelchair if the ramp is steep. To self-propel wheelchair down the ramp, face forward. Have client lean slightly backwards. To go down a ramp with a steep incline, have the client lean slightly backwards. Traverse the ramp facing forward to a slow speed. For assisted wheelchair going up a curb, place your foot on the tilt bar and push down while pulling back on handles, tilting the wheelchair backwards. Move the wheelchair forward and place the small front wheels on the curb. Turn sideways and place your hip against the back of the wheelchair, bending your legs. Lift the handles while straining your legs and bring back wheels on the curb. For assisted wheelchair, backward down a curb, back the wheelchair to the curb. Roll the large back wheels off the curb. Keep the wheelchair tilted and slowly pull it toward you until the footrests are well clear of the curb. For lifting the wheelchair into the trunk of a car, remove the footrests and lock the brakes. Fold the wheelchair, grasping the frame, and place into trunk of car. For lifting the wheelchair out of the trunk of the car, grasp the wheelchair frame and handles. Lift the chair out of the trunk and lower the large wheels to the ground. Unfold the wheelchair and replace the parts.
Thank you for watching our video, and thank you to our producer, Brian Roth.